Funerals and visitations continue tomorrow in Uvalde for some of the 21 people killed at the Robb Elementary School shooting.
The legislative response following the Uvalde shooting has been similar to reactions we've seen in the past. In 2019, state lawmakers created a Texas Children's Mental Health Consortium designed to identify distressed children and get them the care they need.
But the consortium's telehealth services have not reached Uvalde yet. Capitol correspondent Monica Madden has been digging into how one arm of the consortium operates and explains where the gaps remain.
In the year following a school shooting in Santa Fe, Texas, Texas lawmakers poured $100 million into 13 health-related universities to form the Child Mental Health Care Consortium.
I heard from so many teachers and parents and pediatricians that they just didn't know where to go.
One initiative is providing telehealth access through a program called T-Chat.
The focus of it is identifying these students, brief intervention, assessment, and then stabilization, and then most importantly, connecting them to ongoing care in the community.
Dr. Nithya Mani is the Associate Director of the T-Chat program at Dell Medical School. Her hub works with schools in Central Texas, serving more than 200,000 kids. She says that's still not enough.
For any sort of mental health care, you could open up a clinic and it would be full right away. That's the level of need that we have.
It needs to be expanded. Not enough schools have access to the consortium's resources.
Mental health advocates like Greg Hanch say the consortium is moving Texas in the right direction, but there are still large access gaps across the state. Out of the roughly 1,200 school districts in Texas, these telehealth services from the consortium are only running in 337 districts. Uvalde CISD is not one of those districts, but experts warn against positioning mental health as the only solution to preventing violence.
Be careful about scapegoating mental illness when there are likely other contributing factors.
Monica Madden, KXAN News.
Dr. Mani says her healthcare hub out of Dell Medical Center did a lot of initial outreach to school districts to ensure they're aware of these resources. She says aside from outreach, funding is still a big part of the puzzle. Last year, lawmakers budgeted an additional $230 million over 2 years in both state and federal funds to expand the network's reach.